Bismillahir Rahmanir Rahim. Welcome back, friends. Welcome back to another video lecture by Kami Microbiologist. Dear viewers, I hope all of you are well and fine. Dear friends, today in this video we are going to talk about another lipid profile test, that is the LDL test. Okay, the full form is low density lipoprotein. Dear viewers, if you remember, we already talked triglyceride, cholesterol, HDL. Now this is the fourth video lecture that is regarded to the lipid profile, and all of you better know that lipid profile test is meant we can mention it into the biochemistry or clinical chemistry test. So it is actually the clinical or biochemistry test, we can also say like that. So today we are going to talk about LDL test in detail. So my name is Muhammad Kamil Khan and you guys watching my channel Kami Microbiologist. So let's start the video. Dear friends, in this video what we are going to see, first of all we are going to see that what is LDL, then we are going to see LDL test, then we are going to see the diagnostic purpose of LDL test, then we will see the test procedure, normal range, main causes of high and low LDL, and then we are going to see the treatment of high and low LDL. First of all, viewers, let's explain the LDL, that what is LDL. Remember, the full form of LDL is low density lipoprotein. We also call that bad cholesterol, and we also call that LDLC, means low density lipoprotein cholesterol. Okay, this lipoprotein is actually synthesized, or we can say it is obtained when we remove, or when the triglyceride is removed from the very low density lipoprotein. Okay, so then what we will get the LDL. Now if we are going to talk that what is LDL test, so as the name indicate, whenever we want to find out the LDL level in the blood, so it is called LDL blood test. Then we have the normal range. Remember friends, that the normal range of the LDL will be less than 130 mgdl in case of normal person or healthy person. But the person who is diabetic, or when we have a diabetic patient, so then at that case the LDL level will be less than 70 mg per deciliter. Now then we have the diagnostic purpose of LDL. Now why the doctor recommend this test? What is the importance of this test? So by doing this test in our routine, we will check out the cardiovascular disease. This test will also tell us the lipid profile in our body, or we can say the lipid level in our body. Moreover, this test can also diagnose the diabetes as well as high blood pressure. This test can also tell us the treatment of the drugs which we are using for the diseases that is caused by the LDL, high LDL. Okay, so when we are using any type of the medicine, and when we want to check either the medicine is working or no, so for that purpose we can also do the LDL test. Now let's see the calculation of the LDL test. Remember guys, if we are going to talk about the LDL test, that how to perform that test, so normally in many of the laboratory the LDL test cannot be performed. It can be calculated by a formula. Okay, or in some of the advanced laboratory it can be doing by advanced machine like Selectra, like other type of a fully automated machine. Okay, but in most of the laboratory it can be calculated by a formula. So let me explain that formula. So LDL can be find out when you have total cholesterol level. So what will you do? You will minus the total cholesterol with high density lipoprotein, and then the value which you will get from these two panel, then you will minus it with the triglyceride. Okay, finally you will get the value, then you will divide the value by the 5. After that you will get the value, that will be the LDL. Okay, so it's very simple. So for the LDL calculation you have to perform all these tests that is mentioned in the lipid profile. So then very easily you can get the LDL. So this is how the calculation of the LDL. Let's see the main causes of the high LDL. So remember guys, there are different main causes of the high LDL, and remember, when the LDL level is high then 190, so then it will cause different type of disease. Now let me explain these disease. It will cause obesity and diabetes. So in case of obesity and diabetes, the LDL level will be reached to 190, we can say like that. High LDL is also a genetic disease. Due to high LDL, there will be chronic nephrotic syndrome as well as kidney disease. Due to high LDL, high LDL is also caused by a certain type of medication, like we can say steroidal. The high LDL can also cause AIDS. Now due to high LDL, there is hepatic obstruction, and the high LDL is also caused by alcoholism. Due to high LDL, there is multiple myeloma condition will occur. Now the high LDL is also caused by taking high cholesterol in the diet. So these are the main causes of high LDL. Now let's talk about the low LDL. Remember friends, when the LDL level is low, it is good for our body. But as I didn't talk any function of the LDL, remember there is no specific function of the LDL. LDL will be less present in our body, so we can say that there is no specific function. If it is present, so it will not perform any function. If it is high, so then it will cause diseases. So their value will be low, as I already talked, in the normal range. But sometimes if it get low, so let's see that what type of what will happen, or we can also say that in which condition the LDL can be low. So when a person burn, so the LDL level will be low. During cancer disease, LDL will be low, and in chronic anemia, the LDL will be low. Okay, so low LDL will also sometimes cause hemorrhagic stroke, okay, or we can say brain hemorrhage. Now the LDL level, when it get low, so due to this way, inflammation of the joint disease will occur, or we can say in joint inflammation disease, the LDL level will be low. So this is the main cause of low LDL. Let's see the treatment. Remember, if the LDL level is high, so then we have to treat it. If it is low, so it doesn't mean that we will treat it, so no need to treat it. Okay, now let's see the treatment of high LDL. For high LDL, the first treatment is doing daily exercise. So when your weight is high, so obviously you have to do daily exercise. It will reduce your weight, and after that your LDL level will be also reached to normal. Next is, if you are smoking, or if you taking alcohol, so you have to stop it. It will also reduce the LDL level. So you have to lose your weight by stop the eating like fats, high fatty acid food. You have to take good diet, like we can say trans and saturated fats in the food. Now you have to take medications. If your LDL level is get high, so then you have to use medication like niacin and statins. If your LDL level is high, so the main cause is due to the diabetes. So whenever you control your diabetes, so it will also so due to this way, the LDL level will be also controlled. So these are the main causes, or these are the treatment of high LDL. So thank you so much guys for watching this video. I hope you like this video. If you like this video, make sure to hit the like button, share this video, and definitely subscribe my channel to get more interesting videos like that. Thank you so much for watching.